My name is Jean-Luc Vachiéry. I'm a cardiologist, professor in cardiology working at the Free University of Brussels Erasmus Academic Hospital. Pulmonary hypertension, and I would say pulmonary vascular diseases in general, is a very critical field in medicine because it gathers, in fact, the knowledge from the lab, so the cell, changes in the pulmonary vasculature, but also the clinical aspects. In fact, it joins a lot of specialties that includes internal medicine, rheumatology, cardiology and pneumology, of course, but also field of surgery, biomolecular physiology and pathophysiology. So in a way, it's giving us from a rare disease a broader view on health and disease states. We do recognize more and more in the field is the connection between the genetic predisposition but also the clinical presentation. So future research should aim at looking at the biological mechanism leading to the disease, but also the phenotypes of patients that are suffering from any forms of pulmonary hypertension. Even in group 2 pulmonary hypertension, we have different clinical presentations. Future should focus on the fields of biomolecular physiology, changes in cells, genetics, but also looking at the different patients' phenotype and how they do present with pulmonary hypertension. Before becoming the director of the Pulmonary Hypertension and Heart Failure Clinic, I had to start somewhere, and initially I wanted to be an ICU doctor. This is how I started working in Robert Naillet's lab back in the late 80s. Then after that, when I got back to the clinic, I got a strong interest for pulmonary vascular disease and all the implementation that can be made from a clinical perspective. And this is how I decided to become a cardiologist. In parallel with my clinical career, I had a research career in the lab in the beginning of my years and then moved on to clinical research. Of course, things are coming in one piece when you start seeing patients with this disease, and this is where my definite interest with pulmonary hypertension came. It's an encounter with a young lady suffering from very severe pulmonary arterial hypertension at the end of a pregnancy, and that was one of these very important moments that really determined my future career. There are important milestones in the development of pulmonary vascular disease, and the creation of the World Symposium Pulmonary Hypertension Association is one of these important milestones. In fact, we cannot wait 5 years because the disease still develops, the research still develops, and there are new research, new data that are coming almost every day, every week. So we cannot wait for 5 years to provide those data, that research, and these directions for the future. This is why this association is very critical and very important. In fact, it's even more important that it encompasses several specialties in medicine, and also it plans to have joint ventures with other structures that are already existing, and this is very critical.